Hello and welcome. So, you're expecting. Congratulations! You've probably got a million questions, and one of the biggest is always about food. What should you really be eating? Well, today we're going to clear up the confusion. This is your trimester by trimester guide, and it's all based on the fantastic patient education from senior endocrinologist Dr. Praveen Ramachandra using the very latest 2024 guidelines. Let's get right into it.
So here's what we have on the menu for this explainer. First, we're going to tackle that old saying, eating for two, and give it a modern twist. Then we'll walk through each trimester, the foundation, the build-up, and the final push. After that, we'll cover some simple principles for your plate that work for all 9 months, and we'll wrap it all up with an expert's final word. Sound good?
All right, first things first. Let's talk about the biggest, most common piece of advice, or maybe myth, in all of pregnancy nutrition.
I mean, we've all heard this, right? The second you announce you're pregnant, someone is bound to say, time to eat for two. But in today's world, with everything we know now, is that really the best advice?
Well, here's the modern answer. The latest science, and something Dr. Ramachandra really stresses with his patients, is that it's not about how much you eat, it's about what you eat. So the new rule is simple: quality over quantity. It's about making your calories count, not just counting more calories.
Okay, so let's dive into the first trimester. You can think of these first 3 months as building the foundation. Everything that comes later is built on the work your body is doing right now.
Now, this might actually shock you. According to the very latest guidelines, how many extra calories do you need in the first trimester? 0. That's right, a big goose egg. You don't need any extra calories at all. Your body is incredibly efficient at this stage.
So if you're not adding calories, what's the focus? It's all about these crucial micronutrients. Folic acid is an absolute must to help prevent birth defects. And iron? It's literally building your baby's blood supply. So fill your plate with things like whole grains, think roti and brown rice, plenty of dal, leafy greens, and fresh fruits.
And just like that, we're into the second trimester. We call this the build-up, and for good reason. This is when your baby's growth really takes off, and you guessed it, your nutritional needs start to change.
Okay, now we can start talking about extra calories. During this trimester, to support all that amazing growth, the recommendation is to add about 350 extra calories to your day.
But wait, what does 350 calories even look like? Are we talking about a huge second lunch? Not at all. It's actually way more manageable than you might think. We're talking about something as simple as 1 extra roti and a cup of dal. See? A small, simple addition for a really big purpose.
And it's not just about calories. Your protein needs get a little bump too. You'll want to add about 8 extra grams of protein a day. Remember, protein is literally the building block for your baby's muscles, tissues, and organs.
Now, if there's a superstar nutrient for the second trimester, it's gotta be calcium. I mean, think about it. You're building an entire human skeleton. So getting about 1,000 milligrams a day is absolutely key. This is where foods like milk, paneer, and curd are your best friends, along with things like ragi and nuts.
And here we are, the home stretch. Welcome to the third trimester, also known as the final push. This is when your baby does its final bit of major growing and your body's need for nutrients hits its absolute peak.
And you can see that peak demand right here. Look at that jump in protein. Your extra protein needs more than double from the second trimester, up to an additional 18 grams per day. This is all to support that final, rapid weight gain before birth. In this last phase, it's all about keeping those nutrient levels high. You're still focusing on iron and calcium. Vitamin D becomes super important to help absorb that calcium. Omega-3 fats are fantastic for baby's brain development. And let's be practical. Fiber is your friend to help with constipation. And of course, drinking plenty of water is a must.
Okay, so we've gone through each trimester, but let's zoom out. What are the core rules that apply across all 9 months? These are the simple principles that Dr. Ramachandra advises for a healthy pregnancy plate every single day.
This really boils it down, doesn't it? It's all about choosing wisely. On one side, you've got your champions: brown rice, whole wheat roti, dals, and pulses. These give you slow, steady energy. On the other side are the things to limit: refined grains like white rice and maida, and definitely sugary drinks. It's a simple swap with a big impact.
You know, Dr. Ramachandra's patient education often comes down to these 4 incredibly simple but powerful daily habits. Number 1, eat a variety of foods. Don't eat the same thing every day. 2, make sure you're getting pulses, milk, veggies, and fruits in daily. 3, hydrate, hydrate, hydrate.
And 4, and this is so important, take your iron and folic acid supplements exactly as your doctor prescribed.
So as we get ready to wrap up, let's bring it all together. What is the main takeaway? Let's hear an expert's final word on this incredible nutritional journey.
And here it is. This quote really captures Dr. Ramachandra's philosophy. A balanced diet provides the best foundation for you and your baby. Focus on variety and quality, one meal at a time. I love that last part, one meal at a time. It takes all the pressure off. It's not about being perfect, it's just about making one good choice for this meal, right now.
And please remember, all of this fantastic, clear advice comes directly from the patient education materials developed by Dr. Praveen Ramachandra from the DiaPlus Endocrinology Clinic in Bengaluru. It's expert advice you can trust, reflecting the absolute latest in medical guidelines.
So, as we finish up, I want to leave you with a little food for thought. Literally. Just look ahead to your very next meal. What is one small, simple, healthy change you can make to your plate today? Thanks so much for joining me.